Doctor, what are the key things we can do to better our brain?
The key things to better the brain, very, very important question actually, or rather how to improve the functioning of the brain. The first and foremost is one has to protect the brain from trauma. That's very, very important. This is one of my pet projects which I'll highlight. Every two-wheelers, should wear a helmet when he rides a vehicle, when he rides a two-wheeler. Because when a person is thrown off from the vehicle and the head hits the ground, you find the skull bone or the bone fractures. The impact reaches the brain very fast. But if you have a good helmet on that, you will find the impact will be there on the helmet. A good helmet breaks into two and the force doesn't reach the brain. The brain escapes the injury. So protect your brain from trauma, especially two-wheelers, wear a helmet, and those driving a car should have the safety belt on. Protect your brain from stress. Stress is in day-to-day life, you have stress in some form or other. There is no one person who is without stress. So therefore, we have to cope up with it, understand and cope up with it. We can use various techniques like yoga, meditation, and so on. The other very important aspect that your brain has to be protected is the toxic exposure to smoking. Every puff of smoke, around 3,000 to 4,000 toxic substances are there, which gain entry into your lung. And your lung turns black actually. And lack of oxygen to the other parts of the brain occurs. The other is prevent or rather protect the brain from toxic exposure to alcohol. Alcohol is also quite dangerous. It can affect your liver and the metabolic activities in the liver will come to a halt because it is those metabolic activities that takes energy to your brain. So that comes to a halt with alcohol. And alcohol can directly affect and damage the brain too. Then the other aspect is to, protect the brain from idling. That's very important. Keep on and that is never, what you can see that always kindle your brain, some form or other. So protect your brain from idling. Protect your brain from dehydration. Drink at least 1.5 liters of water because 50 to 60% of your brain contains water. So, you have to, over the 1 glass is 200 ml. And you have to take at least around 8 to 10 glasses of water a day. And also protect your brain from undernourishment. A balanced diet is very essential. More so, the nutrient for the brain is oxygen and glucose. Oxygen comes from the air, what we breathe, and glucose comes from the food, what we eat. So, the key things which we can do to better our brain are protect the brain from trauma, protect the brain from stress, protect the brain from toxic exposure to smoking, protect the brain from toxic exposure to alcohol, and protect the brain from idling, as well as protect the brain from dehydration and undernourishment. That's it.
Doctor, what exactly do you mean by telling that one has to protect the brain from idling?
Oh, I know that, you will ask that, And when I say protect the brain from idling, that means you have to keep exercises for your brain. One has to keep the brain young through mental exercise. Your brain is like a muscle. The more you use it, the more you can continue using it. The best mental exercise is acquiring new knowledge and doing things that you have not done before, like a new technique, a new game which establishes new connections. One can change the routine of your life to stimulate new parts of your brain by trying a sport you have never tried before, learning new cooking recipes, learning a new word each day, forgive someone you hold a grudge against, visit new and different places, cultivate and smart friends, then develop creative ideas, use the brain gym exercises, brain teasers which are available online. Listening to music has got a soothing effect which enhances the brain function. The only aspect you have to continuously kindle your brain. At no time you think this is enough, and then the brain gets rusted. To take an example of mine, it so happened that in the last COVID, the first way, the second way, I had to, as a doctor, I had to stop my work for 3 months because beyond the age of 60, one has got to be careful, if you get COVID. And that was, in fact, a very high mortality was there for those people who got it. So therefore, 3 months, I was just getting restless when I'm not seeing patients and all that. So what I thought, I wanted to kindle my brain and stimulate. So I registered for under the UNESCO HIFA, as well as in the University of Porto, Portugal, for a postgraduate diploma in bioethics. And I took it over a period of 1 year, which is purely online. There were about 20 modules, about 80 class sessions, and about more than 19 to 20 debates. All of them were online, and we had people from national and international people together. Around 50 to 60 people were there. So we enjoyed, and at the end of the year, we had an online PG diploma certificate being given to us. So in that way, keep your brain continuously stimulating, learn something new. And suppose, I tell students, see, when you are sitting and studying, especially those are 10, 11, and 12, you are studying one subject. Now, do something which is totally different. See, 15 to 20 minutes is your attention span. After which, you can say, divert it for the next 5 to 10 minutes, something which is out of your subject. Maybe like feeding the fish, or what you can say, watching the TV for some time, or what you can say, talking to somebody, and then what you can say, be back. Or what you can say, doing a little cooking or feeding your dog if you want to. So any one of these, some subject, something which is totally out of your subject, so that gives a rest to the brain. So this is what exactly I meant. Protect the brain from idling. That means continuously kindle your brain.
Doctor, how to improve creativity of the brain?
The creativity of the brain. There's a question that is commonly asked when I go to address students, college students, and all that. They ask this question to me. Though all parts of the brain are active all the time, there are certain activities which are dominant on the right of the brain as well as the left side of the brain. The left brain is for logic, analysis, sequencing, linear, mathematics, language, facts, thinking in words, and computation. All these are the left side of the brain, which is dominant. Speech too. And the right brain is more of creative, imagination, holistic thinking, intuition, arts, rhythm, beats, nonverbal feelings, visualization, tune of songs, daydreaming, music, sports, all this spatial thinking, everything is dominant on the right side. And therefore, one has to do activities to stimulate both halves of the brain to produce creativity. That's why in schools and colleges, I always tell the students, not only one should concentrate on studies, but also participate in sports, games, and other cultural activities so that both halves of the brain are activated and innovative thinking sets in. That's it about the creativity of the brain.
Doctor, is there a drug to improve brain, or how can one strengthen his brain memory?
This is a very important question. Is there a drug to improve memory? Or how can one strengthen the memory? This is again a very common question that is being asked by especially students, at college students especially. And those who are studying in the 10th, 11th, and 12th. Well, I can tell you, there isn't one drug to improve the memory. I don't think there is. But there are drugs which are given like paracetamol, modafinil, cetirizine, galantamine, and several drugs are being tried and given also. But I have a feeling that you can adopt the following methods to improve memory. The most important one is enhance the memory by rehearsing repeatedly. See, the memory has got, the immediate, the short term, and the long term memory. When you say the short term, it is going and getting registered, then retention, then you recall, again you register, retain, and recall. So the more you do that, that is why enhancing memory by rehearsing repeatedly, it goes off into the remote of memory or the long-term memory. When you say long-term, it is not located, we can't say where exactly it is located, more so in the frontal lobe, but it is there all over. And this enhancing the memory by rehearsing repeatedly is very, very important. A class example is when we go for the examination That's my experience. I would have written more than around 100 or 120 examinations over my period. And I have found particularly people read the 1 week prior, a day before the examination, we read, try to recall something. It doesn't come immediately, we are rattled. And we keep on reading the same again and again. And even before entering into the examination hall, we'll be standing and reading there, but nothing registers in your brain. The moment you sit in the exam hall and as you receive the question paper, you see the questions, even if once you have read, immediately, like a waterfalls, the answer flows into the answer sheet. That is the beauty of memory. So that is why enhance your memory by rehearsing repeatedly. It will register in your brain. From a short term, it goes off into the long term. The second and most important is eat a balanced diet, consists of carbohydrates, proteins, fats, vitamins, and minerals. And drink around 1.5 to 2 liters of water. 1 glass of water is 200 ml. So you'll have to drink at least around 10 to 12 glasses of water every day. This is very, very important because it will hydrate the brain very well for the brain to function. Good breathing exercise can improve the oxygenation to the brain. In the morning as well as in the evening, in an open air, if you can do pranayama, is very, very good. As I told you, 2 nutrients which are very essential for the brain are oxygen as well as glucose. And that comes from the diet, and oxygen comes from the air, what we breathe. The fourth one is the physical exercise. It's very good for the brain. Even a simple walking exercise is quite fine, or a jogging. And this improves the heart's ability to pump blood, and thereby good flow to the brain occurs. Oxygen and the nutrients are taken to the brain. And the fifth one is a comfortable sleep of 6 to 8 hours is very, very essential for consolidating your memory. That's exceedingly important. And whenever you are studying for an examination, don't sit beyond 11:30, 12. Go to bed by around 11:30 and get up in the morning by 5 or 6. At 6 to 8 hours of good sleep is essential for consolidating your memory. So these are the factors. Enhance your memory by rehearsing repeatedly, number 1. 2, eat a balanced diet and drink around 1.5 to 2 liters of water daily. 3rd, good breathing exercise, which can improve the oxygenation to the brain. And the 4th is the physical exercise. It's very good for the brain, improves the heart's ability to pump blood, and thereby good flow to the brain occurs, blood flow. And the 5th one is a comfortable sleep of 6 to 8 hours. It's very, very essential to consolidate and improve your memory and also relieves stress. That's it.
Doctor, what is your most rewarding experience and what do you like about what you do?
I always believe that in the medical career of a doctor, there are 3 phases. The phase 1 is 25 to 35 years. One has to, acquire all the qualifications, fellowships, whatnot. 35 to 45 and 50, one has to actively practice your profession, whichever be the specialty. And 50, 55 up to 60, one has to do something innovation in your specialty as well as train the younger generation of that particular specialty. 60 and beyond, one can impart training to or guide the future generation of students. And that's what exactly I had done actually. And after, that is during my assistant, associate, and professorship, I did go as the associate dean and the vice principal of SR Medical College, where I was just guiding the students. Apart from this, I had an interest. In fact, you were asking the rewarding experiences as a doctor. I must tell you, besides actively treating the patients, that's a lovely experience, I had a great interest and a passion in teaching the students. In the process of teaching, I also learn. You see, that's very important. And that's why for the past more than 25 to 30 years as an assistant professor, associate professor, professor of neurosurgery, Madras Medical College, Stanley Medical College, Kilpauk Medical College, I did teach quite a lot of neurosurgeons and who are presently manning those departments. Besides, I had an active interest in imparting education on bioethics, which I joined along with Dr. Russell, Professor Mary Matthew, as well as Professor Princey, Professor Derek, and a good team. We went around across 11 universities in India and taught the heads of departments, professors, associate professors, assistant professors, and even the deans of various of these institutions, imparting the knowledge on bioethics. That is, I believe in teaching, treating, and transforming. Transforming by embracing the changes that are occurring in the medical field. And what we are doing this is the best interest of the patient. So the teaching, the treating the patients, and transforming by embracing the change is all in the best interest of the patient. But personally speaking, the utmost rewarding experience, I think, is when a patient whom I have treated earlier comes back and says, "Thank you, doctor, for helping me and saving my life," which I tell you gives an immense satisfaction and I enjoy a bliss. That is the utmost rewarding experience for me.
Doctor, what is your field of interest in neurology and neurosurgery?
The field of my real interest is in the field of stroke, epilepsy, brain gliomas, and the brain trauma. These are my fields of interest in neurology and neurosurgery.